Mr. Speaker, almost 1 in 7 residents in my home state of Alabama is over the age of 65, a sector of the American population that is expected to grow dramatically over the next 2 decades. As our citizens age, many will develop costly and debilitating health conditions that will require additional care and additional expenditures for the Medicare system. Advanced home health treatments are now targeting some of the most serious illnesses and have been successful in keeping more of the elderly out of the hospitals and reducing a cost to Medicare. There are numerous cases in Alabama where home health care has been instrumental in preventing emergency room visits and hospital readmissions, and helping older residents to live more independently at home for as long as possible. Our goal is to improve the care of Americans and control rising costs, especially in our Medicare population. Home health care is meeting these goals and has the potential to do even more. Yet there are provisions in the House health reform legislation that would cut $57 billion from the Medicare home health program over the next decade. If these reductions remain in the bill, they will surely have an adverse effect on the access to home care for our senior citizens. The cuts in home health care services in the bill are significantly disproportionate to other provider sectors. The bill seeks 14% of all Medicare cuts from home health care, while home health makes up only 4% of the Medicare program currently. This disproportionate impact is further magnified by the fact that, unlike most other health care providers and insurers, expanding health insurance will have no meaningful increase in the home health care business. Home health patients average nearly 80 years of age and are already insured by Medicare and Medicaid. This means that the Medicare cuts to home health agencies are not offset by new revenues from newly insured patients. Instead, the proposed cuts of over 14% of spending on home health services will be as real as can be. For these reasons, I urge my colleagues to reject the proposed cuts to home health care and support better care at home for all older Americans. Madam Speaker, I yield back the balance of my time.